Sincerely appreciate the invite and the chance to be a moderator with such a great group and to be part of such a great event. Looking forward to getting more and more of these events going, both virtual, continuing that thread going, as well as being in person eventually in the future. And so far, just really impressed with the lineup that you had scheduled for the whole day. On behalf of the Office of the National Coordinator for Health IT, I get the fortunate ability to engage with the innovation community. And at ONC, we defined the innovation community in kind of four key buckets, four key areas. And that's early adopters who implement and test emerging technology and novel approaches, entrepreneurs and developers who build technology and bring it to market. We also consider investors who financially support the builders and implementers of new technology and novel approaches to be amongst that community. And then finally, in the fourth category, accelerators, boot camps, associations, and membership networks that support any of the above three categories that I mentioned before. And then essentially, it's people who care about innovation, those who are on the leading edge, looking out at the horizon and figuring out how can we get more things, leverage technology to its fullest potential to try to get things into play. And at the ONC, which sets looks at health IT policy from a national perspective and coordinates with all our federal partners and agencies on that and with the industry, being able to continue to work with that innovation community ensures that we'll always have fair marketplace competition and an efficient marketplace for health IT solutions. Now, Together Health is something that really has been amazing to see come to fruition over the past several years. And we've got three Together Health members, three rock star members of Together Health with us today. A little bit about Together Health. It was a national collaborative that was spun up, combining and connecting together different regional innovation ecosystem champions for healthcare. So all of you are very familiar with Taylor McPartland and his team there in LA and a few other markets throughout the country and what they do to bring together that ecosystem. And in several other markets, we noticed there are other key individuals and organizations that do the same thing. And through Together Health, they found a way to come together, share best practices, and see where do we have shared interests to collaborate on a national level and try to remove that friction out of the health IT marketplace. So without any further ado, I'd like to introduce my fellow panelists. First up, we have Mr. One and Only Paul out of I'm sorry. Paul Reiser. Yeah, I know, right? And it's probably my screen popped in front of me. Paul Reiser out of the wonderful city of Detroit and in the greater Detroit region, which leads a lot of innovation work for Tech Town Detroit and participates in their Med Health regional planning kind of council, if you will. We have going a little bit further south along the East Coast into Nashville, we have Miss Haley Hovios, who's president of the Nashville Healthcare Council and brings together their innovation ecosystem. And then continuing a little bit further down south into Atlanta, we have also Kirk Barnes with TransPharmed, who's worked with ATDC and a number of different associations in the region trying to bring greater technology innovation to healthcare in his market. So I'd like to thank all of you for joining me today and dive right into the discussion. And actually, I don't know if each of you want to just give a quick commercial as far as your organization beyond what I said about it. But Paul, why don't you say a little bit more about Tech Town Detroit?
Yeah, absolutely. Thank you, Stephen, for having me or hosting us today as our moderator. And thanks to all the ScaleHealth team members and my co-panelists today, which, like you said, is great to be with great friends. So, but yeah, a little bit more about, I guess, Tech Town Detroit. We are Detroit's longest standing incubator and accelerator, which has now been in existence over 20 years. We're actually co-founded by Wayne State University, General Motors, and Henry Ford Health System. So we've been providing technical assistance and support service, entrepreneurial services, co-working space, physical lab space. We're kind of this three-legged kind of super hub, as it's described sometimes in the entrepreneurial ecosystem, because we support tech companies. We also support lifestyle or place-based companies, such as coffee shops, restaurants, small manufacturers in neighborhoods across the city. And we have about 200,000 square feet under administration and management that provides a variety of assets and services and resources. MedHealth, as you mentioned, as a proud member of Together.Health, actually was started in 2014, kind of based out of a vision and a need to provide more collaboration and close gaps in Southeastern Michigan and Southwestern Ontario. So it is a bi-national effort. Because of our geographic location, we really see some great strengths and differentiators in this region. But MedHealth convenes innovators, providers, payers, health systems, economic development organizations, and businesses to really accelerate innovative solutions that improve the quality of care. And while we started in 2014 with the focus in Southeastern Michigan and Southwestern Ontario, the work has expanded across the country with great partners such as ScaleHealth and Together.Health and many of the healthcare-focused ESOs across the country, including many of my co-panelists today.
Thank you, Paul. Like I said, an amazing work that's happening in the city of Detroit and the region around it, and a lot of it is being driven and coordinated by my good friend, Mr. Paul Reiser. Haley, what's going on in Nashville, and what does the council do to bring that ecosystem together?
Hey, Stefan, and a big thank you to Taylor and everybody at ScaleHealth for having me today. I am thrilled to be here. I run the Nashville Healthcare Council. We might be considered in this crowd a horse of a different color, so to speak. We represent large healthcare at scale. So if you think about where healthcare in general is big, hospital service providers, you could say the hub in the US for service providers. We're the home of HCA Healthcare, among others, but that has spawned an enormous ecosystem of really large scaled healthcare companies. So you would think about that as wonderful purchasers of many of your products and services. And they do it we consider a small system to have 25 hospitals in it. So from that standpoint, we're not the innovators in our market, but we definitely connect and educate that group. So the council has been, over the last 25 years, building the ecosystem. And Nashville's ecosystem has been compared to Silicon Valley in the way that it grew out of HCA, and you had a lot of investment and reinvestment in the industry over time. With that being said, we are a major part of connecting with our smaller companies and our entrepreneurial companies. We partner with the Nashville Entrepreneur Center, which has actually a healthcare arm called Project Healthcare, and they're getting involved more and more in this type of work. But for now, we're the ones that are trying to help make sure that our Nashville companies, which are huge, are having access to the kinds of innovation that you're doing your work with. So please.
Sandy. And as all you can see, again, Haley points out, it's not always the same type of entity. It's not always an incubator. It's not always an accelerator. It's not always a healthcare institution. Sometimes, like a hospital. Sometimes it's a council, which is a spinoff of their Chamber of Commerce, right? That pulls together their private sector and connects them to all these other innovators in their region. Next, we have Kirk Barnes down in the ATL. Why don't you tell us a little bit about TransferMed and ATDC?
Absolutely. It's great to speak with everyone. So Kirk Barnes, co-founder of TransferMed, that helps really accelerate the innovation and sales cycle for technology with a focus in healthcare. Prior to me launching TransferMed, I actually ran the inaugural healthcare vertical at ATDC, which is the Advanced Technology Development Center, which is a unique entity that it is a tool of economic development that is primarily funded by the governor of Georgia to help technology entrepreneurs learn how to learn, launch, and scale businesses. And so, believe it or not, ATDC, we don't know for certain, but we think it's one of the oldest incubators in the country. It's now 40 years old. And outside of just serving all technology entrepreneurs from ideation all the way to mature companies, we also have these defined verticals that are backed by corporate sponsors. And so what you may not know is Georgia is really big for certain things. So for example, it's a huge fintech presence. 70% of all credit card transactions are processed in the state of Georgia. So it's huge fintech here, huge cyber presence in Augusta with Cyber Command that has a huge facility there as of a couple years ago. And healthcare has been slowly evolving, and especially with an epicenter of a diverse population, rural population, and then a diverse rural population as well as an urban population as well. It becomes an epicenter for a great test bed for technologies that are applicable across many different populations. So beyond working in healthcare, I also, as ATDC, is involved with other projects from like the T-Mobile 5G Innovation Lab. It has a healthcare component of it. We have a hub that's working to connect BIPOC founders across 9 states in the Southeast. And then right now, I would say there's a huge growing presence of Black and technology founders in Atlanta, as well as just a push to get more involvement in Hispanic and Latin, Hispanic and Black founders and patients involved in the healthcare process. And so if you guys are looking for a diverse talent, patient population, clinical studies, we have great partners within Atlanta, as well as institutions like Morehouse School of Medicine as well. So it's great to be here, and love Paul, love Haley and Stefan. We have an amazing Together.Health organization. So it's great to be here. And Taylor as well. Thanks for having me. I'll stop talking.
Yeah, I was wondering, I was actually going to ask Taylor, like, why didn't you want to be on the panel too? Like, you're a Together.Health member and you're part of the crew. And I think he was just worried about having too much screen time and seeming like a prima donna or something.
Right.
Nonetheless,
I try to minimize my prima donna-ness.
Right. We're going to loop you into a couple of these questions or some of these discussion points here. So Haley, I want to start with you. And, you know, it's no secret, all 3 of you, including Taylor, you have amazing assets in your markets, in those regions that you represent and that you guys have a foothold in. And you take advantage of those assets by bringing them together and figuring out kind of what is needed to help them all grow and be successful, right? You, Haley, were part of the initial meeting we had back in 2017, where we brought together, I think, 14 of these different representatives from around the country to start to talk about, hey, what would it be like if we worked outside of our regions and across regions, and what would be the value in doing so? So can you talk a little bit about why that was interesting to you to be part of that conversation, and really, you know, how you saw that as being able to kind of help your market expand and be more successful by working with these other markets?
Yeah, I think that's a great question. And, you know, it was something that we, meaning the Healthcare Council and my team, had identified as sort of an opportunity to connect differently with different markets. There are a few other healthcare councils across the country that do similar work to what we do. But I think what was so appealing about Together.Health is that it connects with so many others that don't just sort of fill the role that we do about just being a council and connecting and educating, but having this innovation perspective. And it was something that Nashville certainly needs to do more to be innovative, to benefit all of us, quite frankly, because the footprints of the companies that are headquartered there are so large that whatever they can do to improve patient care, reduce costs, is going to have an impact on everyone in the country. And so having that connectivity with other markets was really key. I'm also just an absolutely huge believer in the fact that, you know, with healthcare, the problems are so large, it's not going to be solved by any one entity, any one city, any one ecosystem, any one innovation. It's going to take all of us working together, and that removes any of the kind of competition that you often see in an economic development. As Stefan and I both came from that can be a thing. You know, you're concerned all the time about that, but I think in healthcare, the greater good is so important, and our ability to work together can just really have an impact. And so that was very appealing about this group. Plus, it's just, I can't tell you the group of people that work on this stuff, like everyone's doing it because they really believe in the fact that we can make a difference and we can make a change. And that also is absolutely critical to wanting to be a part of anything. So.
Yeah, and maybe you could even highlight, I know that there was a few topics that people like yourselves had brought to that first meeting and said, hey, this is something that I would love to collaborate with another region on. What were some of those ideas that you heard, whether it was your own or somebody else's, that we thought was really kind of appealing that came out of that first meeting in the early days of Together.Health?
Yeah, one of the big ones. So as we were in our ecosystem working with some of these large companies to say, what are the impediments to you being able to work with these smaller companies? Why is that not a go? I mean, this is really hard. You guys have all these resources, but it's really hard. And why is it difficult for the companies on the other side was a question that other markets were really asking. And in both cases, it came out that the idea of the security assessments that people have to go through and how cumbersome those are and how difficult and yet how similar many of them are led Together.Health to really focus on doing a project where we're trying to codify these business security assessments. And so these BEAs that all of a sudden, we weren't able to necessarily yet solve it, but I think that by bringing everyone together, there was real value in identifying a problem, finding ways that we could all benefit from them. And that was absolutely critical. And, I just can't also, from the perspective of beyond just projects and things, the ability to have people that you can contact and say, hey, how are you handling this in your markets? That over time has been absolutely critical to my success and how the council has handled issues that we've had in our market, and also how we're able to draw on resources very differently. So,
yeah, and actually that's a great point on the extra bench that you can call out to and ask for, like, hey, how are you guys doing it, or how's this impacting your market? And I'm going to get to that in a little more detail when we start to talk a little bit more about the pandemic and the events that has taken place and the movements that have happened over the past year. But I want to pivot to Kirk and Paul as two members of Together.Health that joined after it kind of got formally established. So they weren't part of that initial very first meeting necessarily, but shortly thereafter found out, we discovered that they existed and said, hey, innovation champion for the cities that you're in, you should be part of this. Maybe I'll start with Paul. Maybe you can just kind of give some examples about how you've been able to leverage it and how it's been valuable for you to join Together.Health and where you find value. Because I know you've been one of those ones who've worked with Taylor, who's worked with those people and have had meaningful engagements, not just, a friendly phone call, but actually led to, initiatives and projects.
Absolutely. And it's been, it's hard to measure and hard to articulate how valuable this is. It is, I think a lot of us as ecosystem builders in various cities and regions understand the importance of collaboration and connectivity, share best practices, but this was everything that I had worked for and imagined at a regional scale, but on a national scale. And so it was a no-brainer for me to be able to connect with Together.Health, privileged actually to be invited and to be a part of this movement. From, like I said, connecting, convening, and educating are the three kind of pillars that MedHealth stands on. And these are three kind of areas that are very germane to the mission of Together.Health. So it was a glove and hand kind of fit from the beginning. But best practices, the breadth of knowledge across the, I guess it's probably what, 4 dozen maybe different partners. I know it's grown along the years, or the couple 2 or 3 years that we've been doing this, but the breadth of knowledge, like I said, the experience, the importance of identifying solutions that work in other markets and that can be translated, much like what Haley spoke about. The challenges that we know that are in healthcare have no borders, they have no walls, nor do the solutions have borders. So to be able to work with partners, great partners who are doing such amazing work across the country was, like I said, just a gift and a privilege. And it's actually steamrolled into some great partnerships and ability to work with organizations like that we weren't working with either intermittently maybe, but some not at all. The TMCs of the world, Cambia Grove, Mass Challenge, Rock Health, and of course, ScaleHealth, which we formed a partnership with probably about a year ago that is helping to service both of our entrepreneurial ecosystems, even though we're 3,000 miles apart. And that would not have happened, I dare to say, without the support of Together.Health and without this calling to action that it brought.
Yeah, no, it's been amazing. And I know you can provide many other examples. I know there's some national challenge competitions that you guys were able to help bring to your region and be part of. I'm going to go to Kirk now, because I know you also have a laundry list of initiatives and efforts that you've been able to spin up and partner and bridge your market with many others throughout the country. But I want to focus in a little bit more about some of the things that you've been able to do and as it relates to the pandemic, right? So as we all know, the world changed in early 2020, and we went from, hey, what party and what receptions are we going to at HIMSS, to all of a sudden there is no HIMSS, and we will not be having our meeting there, and what is going to be the new normal for how we collaborate with each other and how we support our individual regional markets. So Kirk, maybe you could talk a little bit about what it was like in the early days of the pandemic, being able to leverage this network and understand kind of what was going on in other markets, what were they doing to help meet the needs, and how you can lean on that. Maybe you could talk a little bit about that.
Absolutely. Yeah. I think, we get spoiled when we're going to, these conferences where we see the usual suspects, and it's HIMSS, it's health, it's, these other different conferences, and then all that's snatched away. And, that was a crutch we relied on for a lot of our networking and FaceTime. And so I'll say for me, it was an intentional time to really break out the Together.Health Rolodex. And I mean, I dated myself even saying Rolodex, because most people don't even know what that is anymore. But I think the fact that, and I like to really, puff my chest out about Together.Health, because as Paul and Haley mentioned, I think there's no other organization like this in the country, where you have leadership from the top digital health, innovation, healthcare ecosystems, incubators, accelerators, all in connected in one organization. And what I started doing is really the people that I had not had one-on-one discussions with during going up to the pandemic. In the pandemic, I was intentional about reaching out and having at least a one-on-one discussion. I know Haley and we got to have a great discussion. And then as healthcare is a big, small world, and our paths cross and collide, and there's things that we immediately start working on. And I think the other thing that is the benefit, especially during the pandemic, is, with healthcare, speed can work against us and access can work against us. But there's no need for us to be proud and like, oh, well, I'm at ATDC and we invented a way to do this. I would love to brag and say, I'm taking this curriculum from Paul because it works. And he's did it, he's done it, and it works, so we're going to implement it here. So we've even been able to learn and speed up the launch of certain programs and certain curriculum and ideas. Even like, I know she's not here, Rachel Dixon, the work that she's doing and helping healthcare innovators think about how do you bring innovation to the underserved populations? Because when we talk about healthcare and technology, if you really talk to a lot of founders, and you get into who is the ideal patient that will receive this technology, I would say majority of times you're thinking about a Medicare patient or a commercially insured patient. Most entrepreneurs in healthcare aren't thinking about an uninsured or a Medicare or a patient that go to rural health centers or federally qualified health centers. So I think that was one of the big takeaways, is the time I spent with Rachel in understanding what Prime Health is doing and just the tremendous opportunity to get clinical validation in an underserved population that is really getting, the problem they have are exacerbated even more because of COVID, because they don't have the resources, because things like remote monitoring, telehealth aren't getting, a lot of it wasn't getting reimbursed for that segment of population. So I think being able to use the pandemic as time to connect with some of our Together Health Steering Committee members one-on-one has really, I feel, I'm closer to Paul, I'm closer to Taylor, I'm closer to Haley, yourself included. Stephan, you and I, we go way back now. But I feel closer, and I have a much better understanding of, one, the robustness of the programs that they run, the depth and breadth of the resources that they have at their disposal, and the power that we collectively have together when we're working with one another. So,
Oh no, we've got a little bit of a freeze, it looks like. Am I the only one seeing it? Oh, there he goes. You had a bit of a freeze there at the end, unfortunately, but we did get, I'd say, 99% of everything you said. Cool. So yeah, thank you for saying all that. I know that, something else that I wanted to touch on, I'd be remiss if we didn't, wasn't all about the pandemic. Pandemic certainly helped to uncover some other, issues when it comes to underrepresented populations and, the certain communities that we know sometimes are the ones worst hit in these scenarios. And it's been able, to have the innovation community focus more on that because of the pandemic and some of the extra resources that have been brought to bear and some of the greater focus on telehealth and so on. But we also saw at the same time with the Black Lives Matter movement and the response to what happened with George Floyd and in too many other things to list that happened over the past summer. There was also this big movement and focus around equity in healthcare and DEI initiatives, DEIA even some people would say. That is something that I know that each and every one of you on this panel and many others at Together Health, we started hosting during the middle of the pandemic, our Together Health meetings. We pivoted to having these discussions around this topic and what are we all doing about it? And, discuss the ideas of having a pledge that we could all sign on to. Many, embodied something like that in the market. Haley, I know that you guys put together a pretty, I think you said long overdue type of strategy or document relative to that. Do you want to talk just real quickly a little bit about that? And then I want to go back to Kirk on one of those initiatives that you guys launched down there in Atlanta on the workforce side. Haley?
Yeah, and actually in a lot of ways, it was led by some of my Together.Health colleagues too. And I had been on a call literally the week after George Floyd's murder had happened, or maybe it was even the week of. And I was on the phone with people from Minneapolis, which was one of the members, and just saying, how are y'all doing? How's everything going? And he started talking about sort of what they were saying to their members, and it was such a, I started thinking about what that's going to mean for us in Nashville. At the time, it hadn't touched Nashville, but within 2 days, it had touched everywhere in the country. And Nashville as a market, South, very traditional healthcare moves very slowly. And we got publicly called up as an organization, which was the best thing that could have ever happened for us as an organization, just because it really put a lot of emphasis on this in a way that we would never have had. We would never have been able to get resources in the same way as quickly, and we would never have been able to act as quickly. And so it was a really exciting time for us. We put together a really robust plan with the full support of our board, being engaged. My board of directors are the CEOs of all the major healthcare systems headquartered in Nashville. So HCA, LifePoint Health, which does rural health, Acadia, the largest behavioral health in the country. So it was a big deal for us, and it really pushed a lot of things forward. And for us, there is a heavy element of this health equity. And so now we're bringing together members of our community who are leading these diversity, equity, and inclusion practices within these healthcare organizations, many of them quite new, and really talking about how do we collaborate around health equity. And so I'm really excited from that perspective of being able to take action with the healthcare systems and hopefully bring that to the folks at Together.Health as well, since we do have this opportunity to continue to connect ecosystems. So I think there'll be a lot more to come. We're still early days, but we're really committed, and the board's really committed at this point to continuing to take action over the long term.
Yeah, it's been great. And it's been great to share what you guys have done along with our ONC staff and other federal agencies, and know that this type of thing is happening in these innovation ecosystems. Also, I can tell you that my boss, Mickey Tripathi at ONC, is very big on leaning in around social determinants of health. If you look at some of the things we've done recently to try to further standards in that space and data sharing in that space, you'll see that commitment, as well as overall just starting to really charge our agencies at the federal government with thinking about equity by design and where can we play a role. There's a lot of executive orders right now that are having our agencies look at that. Kirk, I know we've only got a few minutes left, but real quick, can you talk just a little bit about the workforce program too that you guys have launched, and plans for kind of sharing? I know you shared that with a number of the Together.Health members and kind of recruiting outside of the region, but can you talk a little bit about that?
Absolutely. I'm part of an organization called the MBDA, Minority Business Development Association Business Growth Hub, which MBDA is a section within the U.S. Department of Commerce, and it was a grant that is between MBDA, Georgia Tech, ATDC, the incubator I'm a part of, and Morehouse. And the whole goal is to build a hub across 9 states in the Southeast that are to help promote the right resources, coaching, curriculum, connections, all of that for BIPOC founders across the entire Southeast. And so we are working with all of the HBCUs. We're working with not only just BIPOC technology founders, but also small business owners. And it's interesting because outside of our community, where there's accelerators, incubators, et cetera, there's even small business owners that are using technology to grow their business that don't know about grants, that don't even know about SBA loans, that don't know about PPE loans. So we're putting this virtual hub together to connect them and match resources. And it's already quite incredible, just as we have venture capital firms, we have corporate partners that are in this mix that are geared just to make sure that the BIPOC founders have the right resources to succeed. So it's been an amazing initiative. And so if anybody wants more information, please be sure to message me or connect with me on LinkedIn.
Outstanding. Yeah, and I was really excited when you first shared it with the team, with the rest of the Together.Health community. And it's things like this where it plants a seed in the minds of like these other markets when they start hearing about this of A, can I partner with that? Or B, if I can't be part of it, if I miss the boat, how can I spin up something similar in my market? Or is there a role for us to play in helping kind of bring our community together around things like that? Again, for us at ONC and at the federal government, having an organization like Together.Health has been immensely useful. not just when we're pushing out, and making sure that we're trying to get the word out about our new regulations or policies under, 21st Century Cures Act, the interoperability rule, things that we think can help break free innovation in a lot of cases in data sharing, but also for collecting feedback on where there is that friction in the marketplace. And that leads to, in the future, further actions we can take to try to, from a government standpoint, play a role in removing that friction as well. So I can't say enough how honored I am to be part of that community, the Together.Health community. Looking forward to having our agency be, squarely involved in it going forward. And I know that there's many other federal agencies that we've begun to get involved in it as well, and look forward to the growth. Right now I think it's 34 cities or regions that are represented, plus a couple of national, non-regional specific entities like AMA and AHA and others. And it's been great to see its growth. So Taylor, with that, I want to turn it back over to you. I think we're about at time. I want to thank all our panelists. Again, looking forward to seeing you soon in person someday. Who knows when that'll be? But excited to keep working with you virtually in any way that I can.